Hi, everyone. Thank you for joining us today for the hot topic for the COVID-19 vaccines, a conversation with the Health Center at Auraria. This event is organized by students on Auraria Campus. My name is Manny Saldana. My pronouns are he, him, his, and I am an MSU Denver student studying modern languages with a concentration in Spanish. And I'm one of your hosts for today's hot topic.
Hi, everyone. My name is Juan Gonzalez. My pronouns are he, him, his. I am also an MSU Denver student studying electrical engineering. I will be your second host for today's discussion. We are both student event programmers who work as part of the tri-institutional team for the Auraria Campus. Before we begin our event, it's important to note that information about the pandemic and COVID-19 vaccine changes. This virtual event is taking place on Tuesday, March 16th, 2021, and the experts joining us today will be answering questions with reference to the information they have available today. While the event is live now, we want to acknowledge that you might be watching this recording after the live event. So we encourage the Auraria Campus community to visit their institution's website or the Health Center at Auraria's website for updates related to how your institution is dealing with the pandemic. Please look in the video's comment section for a link to those websites.
Today, we welcome experts who will provide information about the COVID-19 vaccine. This is not meant to be a comprehensive update about the COVID-19 vaccine or the distribution at the Auraria Campus. This will be just a casual conversation with the campus leaders about the vaccine to provide access into information to Auraria Campus students. We have questions already set to ask the panelists. We'll also be accepting questions from you, the viewers. Throughout the live event, you will be able to submit your questions to ask the panelists in the comment section. Given the limited time, we cannot guarantee all submitted questions will be asked during this event. At the end of the event, we will share a link to where you guys could find the COVID-19 facts sheet prepared by the Health Center at Auraria. So without any further ado, if the speakers would have liked to introduce themselves and give a quick overview about your role or any other information you guys might feel might be relevant. If Steve, if you would like to get us started.
Sure. Well, welcome everyone. It's a pleasure to be here today and to be part of this panel. My name is Steve Monaco, and I'm director of the Health Center at Auraria, which is the tri-institutional service for the Auraria Campus. And my team has been directly involved with all things COVID for over a year now. We're really happy that we can provide these services to students, and we're anxious to answer questions today so that we can further educate you about the vaccine.
And I am Dr. Ruben Zaria. I'm the medical director here at the Health Center at Auraria. And as Steve said, we have been planning and we've been adjusting and pivoting with COVID testing, and now in terms of COVID vaccine. So welcome.
Awesome. Thank you for introducing yourselves. Our team has prepared some questions about this topic. We're going to give them about 2 to 5 minutes each per question so that we can kind of get through a good conversation through them. I'll ask you to comment on the questions around this topic, but either one of you, please feel free to add as you see fit. We really do see value in all of your expertise. Now, to start off the conversation, Dr. Soria, the first question will be to you. How do we know that the vaccine is safe and effective?
So good start, nice and hard. So all medications go through a rigorous review process. And in this case, it's not a medication, it's a vaccine. So it's along the same lines. And they first go through the company themselves. And then when it goes to the company, they gather a bunch of information, and they provide it then in terms of the CDC. The CDC then goes through a rigorous review process in terms of numbers, and then they present to the FDA to look for approval and stuff like that. So in this particular case, looking at the vaccines, there was submission data for Moderna, and that involved about 30,000 people. And Pfizer, I looked it up, it was about 43,000 people. And then when it came to J&J, which is the most recent one, that's about 46,000 people. And they were all looking at different features of their vaccine in terms of safety being one of them, because that's what the earlier phase trials are to figure out in terms of, and then when they get into bigger and bigger phases, safety continues. For example, right now, AstraZeneca is being stopped just because they are noticing an issue in terms of blood clotting, but not blood clotting like in a leg, blood clotting in the brain. So they are stopping things to take a look at that stuff before they continue forward. So those type of things do get looked at. So it is rigorous. It is one of those things. So all that data was put together, sent to the CDC, then sent to the FDA, and at which point they got in terms of EUA status, which is in terms of, it's called emergency use authorization. So once again, it's still being studied, and it continues. The studies continue through this day because we learned about stuff for our first 3 months, and then another 6 months, and now it just all that material still being gathered and stuff like that. So right now there are studies still continuing in terms of the effectiveness, all that type of stuff. So, and there's a rumor that Moderna might have enough information that it feels comfortable presenting to the CDC and then to the FDA of all its new stuff so that it can remove the EUA status or experimental medication status, so that it can be formally approved as a vaccination effective for COVID-19. So, anything else?
Awesome, thank you for that. Sorry about that. Awesome, thank you.
Okay. Like,
Another question for Steve. Who leads the dispersal of vaccines, and how are they working to improve that system currently?
Okay, two-part question. We actually are working with 2 outside agencies to ensure that we have adequate resources to provide distribution on the Auraria campus. So it's a trifecta of organizations. So it's the Health Center at Auraria, piece number 1. Piece number 2 is a company called COVID Check Colorado, and then a third company called Care on Location. And between the 3 of us, we all have our roles. And so the role of the health center is vaccine administration, meaning ordering the vaccine, storing it, prepping the vaccine, putting it in syringes, and then it goes to the Care on Location people who actually put the shots in the arms during the drive-through. The COVID Check Colorado people are the ones doing registration and checking when people first come into the site. And so it's a collaborative effort. And we had our first go at this last Friday. And the part about improving, I have to smile on, quite honestly, because most people don't know that there was any issues there at all. And, from the standpoint of the end user, probably the biggest thing was there was a delay. It took, it may have taken much longer than it needed to. And so part of that problem was there was some hiccups in the staffing that was provided by both of the other agencies that we work with. So we have a meeting at 1:30 right after this call to ensure that doesn't happen again. So the inference that there may have been some issues was an accurate one on the first one. But here's the good thing. We gave 518 shots in arms that day. And we had gotten 500 allocated to us, so we were able to get extra shots out of the actual vials, which you can do if you pull it up, really precisely. And so people got their shots, and that's what the most important thing is. And then we've got them scheduled for their second shot because that was Moderna that we used that day. So if I didn't answer all of that, just let me know. But I'll stop there.
Oh, that was perfect. Thank you, Steve. And just kind of going off of that, you think Colorado is doing what is necessary to provide the vaccine to its community compared to other states, Dr. Soria?
That's another tough one. In terms of the quick answer is yes, we're doing everything we can. I guess this borders on the line of, in terms of that word equitable. I think that's what you guys are kind of trying to allude to without just literally saying it. Is it being, so the short answer is yes, the state and ourselves are trying to make sure that it is getting to all groups and high-risk groups that are needing that. But as Steve kind of mentioned, that there's some hiccups along the way. And in terms of, and there are some hiccups when it comes to, what's the word I'm looking for, of things being equitable within the state in terms of other minority groups. And it just, in terms of, everyone talks about in terms of vaccine hesitancy, especially amongst the brown and black racial colors, especially in terms of the Tuskegee study. That is going to cause a lot of distrust in the health system and stuff like that. So there's going to be some hesitancy and holding back. So we have to do our best to include them in this process, give them something to trust us, because we ruined that. And it's going to take a long time to get that back. I guess it's that adage, it takes years to form trust. It takes seconds to break it, and it takes forever to repair. And I think we're in that forever process, trying to repair things. Also, in terms of, there are some communities where the vaccine's not even being offered, and I've been reading reports about stuff, and it's one of those things, we say that some people don't want to get it, but if they're not even offered it, how do they know that they're saying no to it? So that's another question we're trying to answer. And in terms of trying to make sure, I know it's one of Steve's things that whenever we have these meetings, we have to be equitable. Another part would be in terms of the vaccine just not being accessible to certain communities. And so we're making sure that's being offered. There's a story in terms of in Florida. So I don't know of one particular here in Colorado, but I know in Florida, there was an agreement made with Publix grocery store and pharmacy to give that. The problem is that to give the COVID vaccine, the problem comes in is that public grocery stores were all in the high income neighborhoods. So that in turn just led to, it's going to be inequitable because people in low income are not going to travel to the high income neighborhoods to get it. So it's going to lead into less access. And then the last time is just in terms of just vaccine screw ups happen all the time. For example, in Los Angeles, there was a special code that was given to a community group to provide it. That code got given away to other people, which got given away to other people. And the next thing you know, those people who had access in an office to a computer were the people who signed up. Inevitably, that's going to lead to inequitable numbers because of the fact that the people who can get on a computer and who can type away and during the day, because at the end of the day, our hourly workers, our manual workers, our people who don't have computers, took them a long time to get onto the computer, but then there were no more slots available for them. So that's going to lead to inequitable situations. So we're trying to work on that and making sure those things don't happen. Whew, that's a long-winded answer, but yeah, sorry.
No,
Steve, I don't know if you want to answer. I referenced you a bunch of times in terms of some of these meetings in terms of how do we deal with inequitable situations. I don't know if you can chime in a little bit more on that and how we trying to make sure.
This is Steve. Yes, I just did an email last night to the Vice President of Diversity at MSU Denver, and all the institutions on the Auraria campus, are definitely see this as a priority. And so one of the things that we are doing, we're partnering with Denver Health, and Denver Health has very similar goals as the Auraria campus does. But one of the first things to address diversity is to ensure that our students have access to the vaccine. Because when you look at the demographics of the Auraria student community, we are that diverse community. We are first generations. We have extreme percentages, high percentages, I should say, of students of many diverse backgrounds. And so one of the things that we're going to do is to prioritize getting Aurarians done, because that fits directly in as step number one of addressing the equity issue, because we are the community that we're trying to reach, quite honestly. And so we will start there. And then once we get our Aurarians done, then we will be reaching out to the neighborhoods around campus and identifying specific zip code areas that we will be actually focused on. And so some of the discussion that I had last night was actually taking a large van and into the communities. Where you can actually give the vaccine on site at somebody's doorstep. That is some of the procedures and techniques that have used back east and have worked very well there. And so we are considering all of those things. And the partnership between COVID Check Colorado, which is an entrepreneurial organization that's assisting with diversity issues with us, and Denver Health and Auraria, and all our presidents want to see the diversity piece really enacted. We're all working together on that, and you will see more of that coming out in the future so that we hopefully can have a equitable distribution with the state of Colorado vaccine allotments.
Awesome, thank you for that. Let's talk more about the coronavirus and the impact on the communities of color and the reality really in Colorado. According to the Colorado Vaccine Equity Task Force, Latinx Coloradans are 2.8 times more likely to contract COVID-19 and make up 29.5% of total cases and 21.5% of the total deaths compared to non-Latinx white Coloradans, despite only making up approximately 20% of the state's population. Native American Coloradans represent 0.4% of Denver County's population, but account for 6 times more cases and more than 3 times the number of deaths. Black Coloradans make up 3.9% of the total population, and the total population make up 2.7% of all cases, but 3.9% of all deaths. So this is for either Steve or Dr. Surya. Is there a major difference in the number of people that have received the vaccine depending on their race or ethnicity?
You know, I don't know that we actually know that within the state of Colorado as a whole. Your numbers, I think, are wherever you got this from, I'm sure that was accurate at the time. One of the things that the state has done is to allocate specifically a certain percentage of the vaccine to their equity task force, which didn't exist before like 3 weeks ago, and now it exists. And so I was on a call yesterday with the individual who is from the Army, who is the person who stands next to the governor whenever he has press conferences on this issue. And he was really in the know about the fact that they've allocated a certain percentage of the vaccine to communities of color to address the equity disparities coming forward. And so what I was encouraged about with that is that they are actually, if they get 100 doses of vaccine, they're taking a percentage of those, and I can't quite remember, it was at least 15%, it could have been 20% of the doses, and they're putting them with the Equity Task Force to distribute in those communities of color. And so I was very happy to see that they took a positive approach to that and a proactive approach, not just saying we need to do this, but having a tangible component that will ensure that vaccine is allocated to those communities. In addition to allocating, though, we have to do a lot of educating, because we have to educate about why the vaccine is safe, why it's important to end this pandemic. We need everyone to get vaccinated. There's still hesitancy in communities of color, and not just community, it's everywhere, but in communities of color, and specifically because of some of the things that Ruben alluded to earlier, we need to address that. And we need to address it with individuals of color who can help us get that message out, because I think that it resonates if people have trust, and trust is built, off of feeling comfortable with those that are sending you the message.
I know this was kind of mentioned a little bit while you guys were kind of responding to these questions, but how can we as a community be more inclusive to the folks in the marginalized communities who might be struggling to get information on or access to the vaccine, Dr. Soria?
That's more of a policy question. I was going to bounce that to Steve, but
you can bounce it to me, Urban.
Yeah, it doesn't have to be either or,
Yeah, I can quickly answer that, because we're going to have to be a little more succinct on our answers, because I saw your list of questions and I want to get through as many of them as possible. Know that by us having an Auraria point of distribution, that in and of itself gives us control. And control is important here, because when you're dealing with this distribution throughout the state, we have no control what goes on there. But we control the Auraria vaccine ordering, because I do that. I'm the only one that does that. And it comes to us through the state, and then we work with those other agencies to set up the clinics. We then can I'm going to use the word target, focus, whatever the word is, on population groups of significance that we want to ensure we get the vaccine to. So the best example I can give you is that we are trying to get that Auraria population completed first because it represents that diverse demographic that we're trying to reach. And right now, as of Friday, we go into 1B4. And in 1B4, it's all faculty, staff, and students who are employees of the institution. It also includes all students who are 50 years of age and older. And so we've got about 9,000 invitations going out this afternoon for our clinic on Friday. Realize, though, that we were only allocated 300 doses last week for this clinic on Friday. So those slots will fill up quickly, but don't despair, because what happens is that each week I apply for vaccine, and this week I applied for 2,500. I got 300. That's not uncommon because there's 800 and some facilities in the state that are dispensing vaccine. So they just don't have the supply chain yet. But I was told yesterday by this gentleman from the military who works with the governor that we will in fact be getting vaccine in much more plentiful numbers in the near future. Because as President Biden mentioned in his address the other night, and it's been repeated, we are hoping to have enough vaccine for all Americans by May 1. And that doesn't mean in the arms by May 1. It means we have the quantity out there to put it in arms. So the goal is by July 4th to have it in the arms of everyone. So after 1B4, which opens this Friday, then we at Auraria, once the state goes to phase 2, which is the next phase, it is open scheduling. And for open scheduling, then what students will be communicating to our student population and encouraging them to go to the link and sign up so that they can get their appointment. Then we will open it up to the community beyond that. But part of the way that we assist in ensuring that our students are taken care of is the control that we have over the messaging, if that helps.
Well, definitely. I know you did mention having trust is a big factor in getting the communities involved and you getting vaccinated. You know, how can we, as a community, be more inclusive with the immigrant / undocumented community to make them feel confident enough to, come to one of the sites to get vaccinated? If you want to expound on that just a little more.
Sure. I think it's really important that we find out who are the folks in particular communities who are well respected and already trusted. In some communities, that could be the church leaders. In other communities, it can be individuals who run their community organizations. Those are the folks that we are tapping into right now. And the governor has a task force that MSU Denver and the other institutions will be having a representative participate on that statewide task force for diversity. And when I saw the list of names of the people that are on there, these are, in my mind, heavy hitter folks of all different nationalities, races, etc. And what's important about that is these folks know how to make the system work, and they know how to get into the communities of color and low income areas. And if they can do that to the extent that I think their experience will lend it, then we have a very good shot of them having the inherent trust already built with those individuals in those communities. And making it a grassroots effort is really important. One of the things that I did hear was that there was an organization hired to help with this outreach. And one of the qualifications was that the individuals that were doing the outreach were of the same racial background, that of the people who they would be going to the door and knocking on. Because quite honestly, it's important that there's an immediate trust. And if trust is built because of likeness, then that's important to consider, because we need spokespeople from every race and nationality to get out there and help us in those communities of color.
I'm going to chime in a little bit, just for a little bit more in terms of just plain out black and white. When we send out invitations, there are only 4 bits of information that we need: name, date of birth, campus ID number, and an email. Nowhere in there is anything regarding immigrant status of any sort. And so so it doesn't go anywhere. That information is then used in terms of setting up, in terms of some of the CIS, which is in terms of Colorado Immunization Information System, which will allow them to record that that person with that date of birth was given this particular vaccine on this day, that type of stuff. And once again, no immigrant status data is collected or asked for.
Thank you for that. Another question for the both of you. Actually, it's kind of a 2-part question. Why are some communities still not able to receive the vaccine? And although responses to the vaccine seem to be mostly positive, the media has reported mixed community reactions. While some are excited, others are nervous about getting the vaccine. Are there ways we can improve the confidence that people have in taking the vaccine?
Yeah, we're both thinking our response. Go ahead, Ruben.
This is something I'm going to go a little rogue on Steve here in terms of, we haven't discussed this portion of things, so sorry, Steve. I think part of it is people like me. I am, in terms of a healthcare provider, and the messaging that comes out of my mouth. In terms of, sometimes I look like I'm in cahoots or getting, I'm with the vaccine companies of some sort, that type of stuff. The other end, and then oftentimes in some of the messaging, if I don't have the right answer, you know what, I'm not giving you the answer that you're looking for directly. And that sometimes erodes in some of that trust issue in terms of some of the messaging that's coming out, because frankly, some of the science is not there yet for me to give you the answer that you're looking for in particular. And so I don't want it coming back at me so that it doesn't look like I lied, or it looks like I was misleading somebody. So there are a lot of times when the messaging from health experts on TV, they're working around the answer because they can't provide that answer. They don't want to look distrustful, or look what happened to Fauci when he talked about the mask all the way at the beginning. The mask is only for healthcare providers, that type of stuff. And then it came back to him, 6 months later, when people were playing it back. It's because at that particular time, the context was we didn't have enough masks for everybody. And so it was the high risk groups, thus the healthcare providers, that needed those masks. Later on, then when we had enough masks, then it was for everybody, because it definitely showed improvement in terms of protection and less transmission. So that's one of the ways we can improve our messaging, is just being honest and being able to say, I don't know, or being honest to say, hey, the science is not there yet. That type of thing. So yeah, that's right off the cuff. There's nothing written about that.
The other thing I would say too is that I think it's really important that we answer people's questions and that we dispel myths. Because if you go on the internet, which I think people go on there all the time, and that can be good, bad, or indifferent. And when it comes to the vaccine, there is a lot of misinformation out there. And so I think it's really important that we provide credible sources for information to ensure that individuals are getting accurate data. And then if there are reservations, I also think it's really important to understand what the specific individual reservations are. Because if you can't address the underlying issue of hesitancy, you aren't really ever going to change them from being hesitant to being someone who proactively wants the vaccine. So I think we have work to do there. And I think we need an army to do that, because we're very busy with the logistics of getting the vaccine, getting into the arms. We can't be out there as medical folks putting those messages out there to the extent that we'd want to. So that's why we're hiring others to help us do that. And we're enlisting groups on campus to help us with that messaging to specific audiences.
As far as the vaccine goes, what does the research tell us? How soon will someone be better protected after taking the final dose of the vaccine?
Ruben?
Oh yeah. So so it's the easy answer is 2 weeks, because it takes roughly, you start forming antibodies roughly at about 2 to 3 days right after an infection, but in this case, it's receiving the vaccine. But it takes a while for that vaccine, the antibody level to get up to a protective level where there's enough that you can react quickly. And that takes about 10 to 14 days. So the answer has always been 2 weeks, because that will take care of most people. The only umbrage I have is in terms of that protection word that you use. And so that's probably another, because it doesn't totally remove, getting the vaccine doesn't totally remove the risk that's involved, because you can still get the infection. It's just, what we do know is that if you do get the infection, it's going to be a mild case of it. And so it's reducing, in terms of all the vaccines are showing, it's really good at preventing severe disease. It's preventing in terms of hospitalization, and it's definitely preventing against death, which are the worst outcomes out there.
I don't know if you would want to add anything to that, Steve.
No, I think I'm good. That was good. That was a really good response, because you can go down a rabbit hole quickly, and we don't want to do that.
Definitely.
I'm gonna go ahead and ask the final question, and this one is gonna go out to Steve. What can we do at the Auraria campus to inform our students of what is going on with the current COVID-19 vaccine, and how students can themselves keep up to date with the most current information?
Okay.
And then, sorry, I forgot to mention this is a two-part question. Sorry. And then to conclude, this goes to either of you. Do either of you have any final thoughts you would like to share with the Auraria campus community?
Excellent questions. Okay. Let's start with the beginning part of that. The communication that we are doing is multi-pronged. And one of the things that we're doing is weekly, there is a update that the health center sends out about different topics that are kind of the hot topics similar to this, that are on people's minds, and also about where we are with vaccine distribution on the Auraria campus. And those are sent out weekly to all Aurarians at all the institutions, but many people may not see those. So we keep those in an inventory on the health center website. So I think it's really important that folks know that that link it's healthcenter with the number1.com, healthcenter1.com. And when you go there, you'll be on a landing page that has a young man with a mask on, and you basically just hit learn more, and that'll take you to everything you want to know about testing for COVID. It'll talk about the vaccine. There'll be frequently asked questions, which we continually update. And there will be a list of all the historical updates, because it happens every Thursday. And you could go through and pick any of the dates and see what we've said a month ago versus what we said this coming Thursday. And so I think that's an important way to give people the opportunity. They can do it in the morning. They can do it at 3 a.m., if they want to get updates there in case they miss it otherwise. One of the things that's happening with the invitations is that we have the names of our Auraria constituents, and we get those from HR and from the registrar's office. And so invitations are going out to communicate to folks about them being eligible for the vaccine at the appropriate phase. And so I think that's an important component too. We do get people advance notice saying, hey, listen, we've got vaccine, look for your message. We use the university communication vehicles. At Metro, it's the Early Bird is one of them. We also send messages out directly to students. There was one that went out last Thursday that I do think is important to mention. It was a survey or form that we ask everyone to fill out. And, we sent over 50,000 of those out. We've gotten about 10,000 of those back. So we aren't doing awful, but we aren't doing as well as I want to be doing. So people should go look at that email, because what we're trying to figure out is there are numerous ways that individuals can qualify according to the phases that the state has designed for the rollout of this vaccine. There are pieces of information about individuals that we would not, as institutions or a health center, know. For example, if your medical care is occurring at a doctor in the community rather than the health center, then we wouldn't know if you have 2 medical conditions that qualify you for a particular phase or 1 medical condition. Another example, if you work at a grocery store, we wouldn't know that either. There's a whole list of about 13 things. If you work in agriculture, that's another one. But we want you to fill that out, because we're taking that information that you give us back and putting you in the appropriate phase then to get that communication directly sent to your email. So keep watching your email would be one of the things that I would certainly want to say to folks. I need to talk a little bit about the allotment process. Each week we apply for X number of vaccine, and I mentioned it before, and we do not get what we ask for. So we basically, you got to, use what you've got. And so there will be times where we have many more people wanting the vaccine than we have appointment slots. Please keep in mind that you will continue to be on the list, and every week you'll get an invitation as long as we've been given an allotment of vaccine. And I think that it's going to work. I think we will get much more vaccine in the future. And rather than doing 1 clinic a week, hopefully we're going to be doing 5 days a week, if not 7 days a week, with tons of vaccine available. Because within the next 3 weeks, I think we're going to see that huge light switch and vaccine come into the state of Colorado. Because the question that was asked previously, is the state knowing what it can do? Colorado is doing actually a terrific job of their vaccine administration compared to many other states in the country. We are far ahead of many others. We're probably in the top 10%. It doesn't mean we're perfect, because you can't be perfect when you don't have the supply chain coming. And so once that gets fixed, we will be able to immediately see a ramp up within the state of getting our citizens taken care of. The only other thought that I had, and I'll turn it over to Ruben for final comments, is vaccine does not mean that you stop doing the safety protocols. You need to wear your masks. People need to do that until further notice. They need to wash their hands. They need to socially distance. Unfortunately, what we are seeing is, as word of the vaccine becomes more prolific in the news and more people get it, we see those public health measures wane, and we can't see that wane. We will see an uptick if we do not continue at the same time to simultaneously get people vaccinated and maintain the public health safety protocols. So when people come back to campus, for example, in the fall, we will still be wearing masks. It's uncertain whether we'll have to social distance. We need a little more time to pass to see how many people we can get vaccinated as to whether or not social distancing can be relaxed, because that's a public health order right now that we have to comply with. That public health order may be changed as we get to July and August. We will find out. But I am pretty positive that mask wearing will continue through the fall semester at a minimum. Because one of the things that is been noted is this has been a really good flu season. Why has it been good? Meaning not that many cases. We've had masks on. That's been the issue. We socially distance. And so the flu transmission has been much lower. I know that colds and things like that have also been, we haven't had as much of that because we've had the masks on. So the masks work. And it's important for me to say this. Wearing a mask is not a political statement. It is a public health measure. And anyone that confuses the two, in my opinion, is approaching this the wrong way. We need to protect each other as a community and as citizens. And if wearing a mask does that, which it has been proven that it does, it's the #1 thing, then please adhere to that. On that note, I'll turn it over to Ruben.
I guess the thought I was thinking of, and Steve and I did not rehearse this in any sense, but it's going to be a takeoff of what he's talking about in terms of it's important that everybody participate. And the reason why that is, and this term is, we haven't discussed it, but it's herd immunity. And the way I kind of think about herd immunity, and I'm not sure which animal group it belongs to, but I want to say it's bison, where they keep their young ones in the center, their vulnerable ones, and they keep the adults on the exterior portion of things to help protect the bison in the center, the vulnerable ones. And if we don't get people protecting, the problem with that chain or that circling effect is there are too many holes, which allows other predators to jump in. And if we're not participating in the vaccine program, we're creating holes. So if we don't reach, and they're anticipating right now, at least 70% of people need to be vaccinated. But if we're also not doing, because vaccine is not 100% protection, not at all. It's just, so that's why we need to continue with the face mask wearing to help prevent that. We're going to have to continue in terms of when we can social distance, that'd be protection. Those gatherings, those large gatherings, we got to be careful about those because there's going to be a certain portion of people who are not vaccinated and will continue to pass it on. Now the new worry is those variants. And it was not unusual. People are already predicting that because it's a virus, it's going to change. But are those changes to a point that it's going to be more infectious and then worst off, more deadly, those type of things. And so we have to protect it. We got to protect those young ones in the center who are not vaccinated for whatever reason, they can't be vaccinated, or people, so that we prevent continuation of this disease as best we can. And we're able to mitigate the losses as best we can. That was just off the cuff again.
Awesome. Thank you for that. Thank you, Dr. Surya and Steve. Well, I want to give a huge thank you to the both of you for being our panelists today. You have made this hot topic very educational, very informative. We really appreciate that. To all of our viewers, please see the video's comment section for website links mentioned during this event. I hope you enjoyed listening in as well. If you like tuning into this live stream, you can follow us on Facebook or Instagram to stay updated with reminders for all of the upcoming events we have planned for the semester. Our next hot topic discussion will be about the future of artificial intelligence on Thursday, April 8th at 12:30 p.m. Thank you all again and enjoy the rest of your day.